Everyone. Are you all able to hear me?
Yes, ma'am.
Great. Very good afternoon to all. I hope all of you are doing well. So, warm welcome to each one of you in today's workshop on counseling for cancer patients. So, I will be facilitating today's session. Myself, Arpita Roy. I'm an RCI licensed clinical and rehabilitation psychologist. So, I'm having multidisciplinary experience as I have worked in both academic as well as clinical fields. It includes a lot of neuropsychiatric clinics, psychological treatment centers, the addiction cum rehabilitation centers, audiovisual production house, where I have been associated as personality development counselor. Here also, I do run a certificate course in personality development and body language, which is always on my mind. I also have been a part of the National Trust. You must have heard of it. It's a government welfare body for autism, cerebral palsy, and mental retardation. Also, I have been associated with schools and NGOs. Apart from this, on a regular basis, also I have been dealing with a lot of cancer patients, different types of cancer, different areas was affected, how they're struggling, and a lot of organizations which deals with cancer and the organizations which provides medication for cancer. I work for those patients as well. I have also been a former lecturer at the University of Calcutta and a clinical psychologist at a government hospital. I'm having experience in working with clients having organic disease, mood and anxiety disorder, schizophrenia, personality disorder, mental retardation, and childhood disorders. I also give family and marriage or couple counseling where both pre-marital and post-marital difficulties are being dealt upon. And here also I do run a certificate course in couple and family. I have also worked with special conditions like deliberate self-harm, bereavement, substance abuse, learning disability, LGBTQ counseling, and here also we are having separate courses with regard to these areas. I am an expert in conducting psychometric assessments for adults as well as children. And I'm a trained psychotherapist, and I use my experience into customizing therapies, which includes CBT, RABT, BBT, MET, play therapy, supportive psychotherapy, SFBT, mindfulness, grief therapy with my clients. Apart from this, I head my clinic offline as well as I take up clients online on a regular basis. So this was about me. So before we move into the topic of counseling for cancer patients, which is indeed a very important and a very serious and a very concerning part, I would like to know a little bit about you all also so that I can connect with you all. Accordingly, I'll go ahead with the explanations so that each one of you gain a lot of knowledge and interest from today's discussion. So I would request all of you to turn on your cameras and unmute your devices one by one and just introduce yourself in brief. Just your name, your qualification, what you are doing currently, and what made you join today's seminar. That will be a great way to start. Let's proceed.
Hello, ma'am.
Please go.
Hello. I am
Yes,
Swagata from Kolkata. Am I audible?
Yes, you are on.
Okay, thank you. A very good afternoon, I will say. And I presently work. Hello. 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 Hello.
Let's proceed with others. Why did I wish to join us now? Yeah, please do.
Hello. 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 Ma'am, can you listen to me?
Yes, yes, now I can hear you. You don't
Okay.
have to turn on your camera. I guess you're facing some network issue.
Yes, ma'am, perhaps. I'm Swagata from Kolkata. I am associated with Health and Family Welfare Department, Government of West Bengal, and I have studied MA Psychology from IGNOU. So presently, I have to deal with cancer patients because there's a national program of National Health Mission. So I am associated with that program. So I thought that it will be beneficial for me if I attend your class and have some extra kind of information that will help me in doing my job day to day. So I have joined this class.
Oh, that's fine. You're welcome.
Thank you, ma'am.
Hello, ma'am.
Yeah.
I am
Yes, we can hear you.
Obhipsha.
Abhishek.
I am Obhipsha. I am a MSc student, just passed out. I did my MSc from Rajavajar Science College with a clinical psychology specialization. I want to work and I'm looking forward. Especially, I am here today because my mother is recently diagnosed with cancer, and I have to deal with it now. Presently, I am living just with my mother. It's the two of us. So I want a better environment, home environment, firstly. And second, I have this wish to work with cancer patients because I have seen many cancer patients in my family only. So that's a wish of mine.
Others, please go ahead and tell them.
Hi, am I audible? I hope I'm audible. And
One of them. We are able to
yeah.
hear you.
Also, I think we're not able to hear it if it's just me or other people. I'm not sure if you're able to hear your voice clearly, Arpita. So there's some glitch that's happening in between sometimes, and I'm not sure if it's just me. I just want to.
Others, can you please confirm? Are you able to hear me? Yeah, please go on with your please.
Yeah. Hi, I'm Tamanna. My pronouns are she and her. And yeah, I am a private practitioner and I'm working currently online, but I do take offline clients in Dehradun. I'm like based out of Dehradun. And my reason for joining this workshop was similar to what one of the participants just mentioned, how I've also had some personal experiences with people having cancer in my house. And also I'm like very much interested in psycho-oncology, and that's something that I want to take up in my future training. So it's better to start somewhere. So I think I just started with applying for this workshop.
Definitely, we are also having certificate courses in Psycho-Oncology.
Hello. Hello. Am I audible?
Yes, you are audible. Please go.
So my name is Apeksha. I've done MSc in counseling psychology, and the reason for me to join this workshop was that I have interned at a cancer center here in my place where I live in Nasik. It's called Manavta Cancer Center, and I have worked there for 3 months. And I recently applied for a job there because they have a need of a psycho-oncologist, and I had some good references having worked there for 3 months. But I don't have any theoretical knowledge. I have a practical knowledge of observing patients and seeing my mentor and head of the department of psycho-oncology interact with patients, and she taught me many things, but I don't have the theoretical knowledge which I need, so hence I joined this workshop. Thank you.
Hello, good morning, ma'am. I'm Sophia Anjum. I have done my master's from Usmania University in psychology. And I'm working here in UAE as a counselor in a school. And the main purpose for joining this workshop is actually my mom is fighting with cancer. So I thought after joining this, I could be of some help to her. Yes, thank you.
So I think you have joined the other courses earlier also.
Sorry, ma'am.
Have you joined the other courses earlier?
Other places in the sense, in UAE, in Ajman, I'm staying.
Yes. You had psychosection with us. You have joined the other courses as well, or you?
Oh, other courses. Yes, ma'am. I've done mindfulness, and I have attended 2 or 3 of your lectures.
You have done a lot of sessions. Yeah.
Ma'am, you're not audible, ma'am.
Better now?
Better, ma'am.
Okay. Yeah. About others, you may also type it in the chat box, mention about you.
Ma'am, not audible.
I'm
Speaking. Yeah.
I don't think it's a problem with the network, but there's something with issue with the speaker. So their voice is like, what, I'm not sure what's happening actually.
When your voice is quite clear for me, but ma'am's voice is very low.
Yeah, exactly. That's what I
Now,
was
can you tell me,
thinking.
is it better?
The volume is low, ma'am. This wasn't the case for earlier workshops. And
Is it better now?
better, ma'am.
Now better?
Yes, ma'am.
Okay, now I understand. It's because of the fan, it was interfering.
Oh.
Okay, so let us then proceed with today's session. I'm having a sore throat, so for any of the part, if any of you are having difficulty in understanding, please let me know. I'll repeat again. And this is indeed a very vast part when we are talking about counseling for cancer patients. So first of all, let me tell you what all we are going to discuss in today's session. So today we would be, first of all, discussing about understanding cancer stages and looks, because when we are dealing with our clients, this is also a very essential part to understand, because depending upon the different stages, different complications of different age.
Jan? I'm sorry.
We will also be discussing about the role and importance of psycho-oncology, the psychological aspects of cancer management, breaking a bad news. These are the practical areas. The psychology of grieving, taking care of a terminally ill patient, caregiver burden, palliative care, oncologist burnout, and euthanasia. This would be the areas we are going to cover. Okay. I'm going to keep it very simple so that everybody gets to understand on the parts, but I would also at the same time request you all to take notes, because a lot of things we would be discussing. Of course, I'll also share the session recording, but many a time it happens because of technical glitch. Maybe it's not working or it's not accessible. So to be on the safer side, I always suggest to take notes. So let us then proceed with the part. First of all, we will be discussing about a concept, psycho-oncology. Although when you people were also introducing about yourself, you use this term. So what is psycho-oncology? Psycho-oncology is a growing area in oncology. Oncology department, we know, in hospitals we have. So cancer departments are referred to as oncology departments. So what happens here? Oncology patients or cancer patients are treated. Now, many people think, or previously, not only many people, even the medical team previously used to think that only the physical checkup, the treatments like chemo, surgery, medicines, immunotherapy, only these things are essential for a cancer patient to recover or fight with cancer. But they didn't understand that the resilience, the stress management, dealing with the shock that the person is being diagnosed with cancer, the everyday stress, depression, anxiety, these are also mandatory to be handled. So by only treating them at a physical level, we were not able to complete the treatment 100%. So when we talk about an individual's health, health includes mental health and physical health. So when we are talking about treatment, of course, that should also include the psychological part, which was previously lacking. However, later it was understood, and now it is a mandatory part of the treatment that is being included for cancer patients. So psycho-oncology focuses on the psychological, social, and the emotional impact of cancer on patients, on caregivers, and on the health behavior. It addresses the psychological issues affecting patient and caregiver quality of life. Because of the disease, because of the treatment procedures and other associated things, an individual's quality of life also deteriorates. So that's also very concerning. So psycho-oncology empowers the patients to take a positive and active role in the cancer. And it empowers the individuals to reduce the risk of cancer. Now, when we are talking about these parts, I have been dealing with a lot of patients While previously they were diagnosed with cancer, then post-treatment, they were free from it. Doctors mentioned that now you are safe, now you are fine. But again, after maybe few months or year, it's a comeback. So why did it again? Despite of taking all the necessary things. So it's really very devastating for a patient mentally. But you know what? Mental health and physical health is interconnected. So the moment the stress levels increase, it starts to affect the immunity. And for cancer patients, if their immunity is weak, they won't be also able to take the treatment. So Psycho-Oncology helps the patients and families to adjust to a difficult disease and the difficult procedures that are involved as a part of the disease, so that they are getting trained how to deal with the difficult situation in a much more efficient way. So why is Psycho-Oncology important for cancer patient? Just now in detail we were discussing. So emotional and psychological support during the cancer diagnosis and the treatment if an individual is getting properly, then it may significantly improve the quality of life of a patient, significantly. And yes, who doesn't want that? That's mandatory. It increases the patient's ability to manage the treatment. The treatment process is not easy. The treatment process is difficult, it's painful, it's pathetic. Lots of compromise, lots of limitations in their lives. That's happening because of the treatment. It reduces related stress and anxiety. More the level of stress, poor will be the immunity. Greater the anxiety level, poor will be the compliance. So this also gives the patients a greater sense of control and inform the patients about what they are likely to experience. That part is also good. When we are talking about our life, this is how it is expected. It should go in a straight line, well maintained always. So this is how we look at life. We expect it to just go on and on with no ups and downs. But what if there's a chronic disease? Something like cancer? Then what? Yeah, fortunately, medicine today can help us recover and keep us comfortable. But that too is having a limitation. However, at times, medicines cannot stop the progress of the disease. And for cancer patients, it's so watching. So when the doctor indicates that end is near, the patient finds it difficult to believe. What? Am I serious? How long do I have? What will happen to my family? And so many other associated things are coming up in an individual's mind. And it becomes so difficult for the person then to match up with the things. So it's not only the patient suffering, so does the family also suffer. Are you sure? There is nothing you can do. What do we do now? Ultimately, we don't want to lose something. So the patient and the family must feel free to share their fears and concerns with the doctor. They are. But the counseling part is not the function of a doctor. That part, a psycho-oncologist or a counselor, a mental health professional is taking care. This is the first for some honest communication, the time to take some decisions together. So we work as a team. So no pain, no distress to the patient at any time. Always respect the patient's dignity, likes, and the right to make the decisions. Allow the patient to express the preferences about end of life care. And it is also important to honor the patient's wishes. So when we are talking about all these parts, so apart from pain and comfort care, end of life care provides psychological, spiritual, and a social support. So life eventually ends, but the end of care, it should not. We must continue. When we are talking about these areas, whenever we come across this term, it brings terror for us. This is something which we would never love to hear for even our enemies. But that's unfortunate. It's always not in our hands. Yeah, there are certain things we need to do so that we can save ourselves from getting affected. But still, there can be some limitations. So, cancer is a disease where cells grow out of control and it invade, it erode, it destroy the normal tissue. That means here, the growth that is taking place, it is with regard to the growth of certain cells which are not required. And because these cells are growing out unlimited, what is happening? It is affecting the healthy cells in the body as well. So as it is affecting the healthy cells of the body, day by day, we are seeing deterioration or complications in it. So the normal body cells grow. Normal, everybody's body cells, it's growing. It divide and it die in an ordinary fashion. It's a process. But in case of cancer cells, what is happening? Take a look at this picture and now compare that picture with this one. Unlimited cells are growing, which are unnecessary. Cancer cells are different because they do not die. They just continue to grow and divide in a disorderly fashion. These are not required. This is not at all required. So cancer can occur at any age. Previously, people used to think, oh, at so young age, how can cancer take place? At this age, no, cancer will not happen now. But there is no particular age that beyond this age or by this age, cancer would not take place. 67% of cancer deaths occur in people older than 65 years. Why? Because the more they age it, the poorer would be the immunity or the lesser would be the compliance. Because of that, maybe the body is not in a good enough position to fight the cancer cells or to take the treatment. As we have already discussed, the treatment procedure is not at all very smooth and very easy. So that part is also good. Take a look at the cancer statistics. So heart disease, cancer, so the death rates, highest we see in case of heart disease, then cancer, chronic respiratory lower diseases, diabetes, Alzheimer. So death rate is so high in case of cancer. That doesn't mean all patients who are suffering from cancer will be dying. There are different types of cancer. When you are working as a professional or you are dealing with cancer patients, you need to guide the patients as well as the family members. So what needs to be done? We ourselves need to have knowledge about the types. So there are two types of tumors. One is malignant tumor, another one is the benign tumor. In case of malignant tumor, it's spread to other areas in the body. But in case of benign tumors, they stay in one place. So targeted treatment often improves the condition of the patient. Now the point is, people don't understand so much until and unless you make them understand. They just hear the term and start to panic. So somewhere, lack of understanding or lack of knowledge can increase the anxiety levels. Now take a look at the main features of the different cancer types. In case of malignant tumor, the growth rate is rapid, but in case of benign tumor, it is slow. In case of malignant tumor, the nature of growth, it invades the surrounding tissue. But in case of benign, it is staying in the same tissue. It's not spreading in the body. So relatively less dangerous. In case of malignant tumor, it spreads. It spreads via the fluids, the blood, and it flows into the entire body. But in case of benign tumor, it doesn't spread. In case of malignant tumor, cell differentiation is usually poor. But in case of benign, it's nearly none. No major problems. Now, talking about the common environmental factors leading to cancer, tobacco. We know that's the leading cause. And on top of boxes, when people buy cigarettes, it's also mentioned. Previously, they used to mention tobacco is injurious to health. But now they mention smoking kills, tobacco kills. So it is very, very important for us to understand this. And nowadays, diet, fancy food, tinned foods, ready-to-eat meals, stored in freezer, those foods, obesity, 30 to 35%. And that's the reason why frequently nowadays we are hearing more about heart attack and cancer. It's because of the lifestyle. And then people end up saying, I don't know why it happened. It's how you treat your body. Infections, radiation, stress, lack of physical activity. Nowadays, people's activities are limited to their chair. It's a major problem. Environmental pollutions, these things are also there. Apart from that, there are some other causes of cancer as well, like benzene and other chemicals, drinking excess alcohol, environmental toxins, such as certain poisonous mushrooms, type of poison that grow in peanut plants, excessive sunlight exposure, genetic problems, obesity, radiation, certain kind of viruses. These things can also be taking place when we are talking about cancer. Now, the next thing, when we will be dealing with cancer patients, we need to be aware. Cancer doesn't always mean the same thing, and there can be different types of cancer. Everybody is not diagnosed with the same problems. There can be different types of cancer. Some of the common types may include bladder cancer, lung cancer, breast cancer, colon and rectal cancer, non-Hodgkin lymphoma, endometrial cancer, pancreatic cancer, kidney cancer, prostate and thyroid cancer, and so on. So depending upon the types, certain examinations are to be carried out. Now you might be thinking that, okay, we are psychologists. So why do we need to even know about what examinations are carried out or what tests are used to understand or diagnose cancer? It is important because you need to psychoeducate the patients. They might come up with a lot of queries. So if you say, oh, I don't know, it could know. So it's important for us to know. Biopsy of the tumor, it's very important. Blood tests, bone marrow biopsy, chest X-ray, complete blood count, CT scan, liver function tests, MRI scan. These kind of things will help us to understand about the syndrome. So once that is diagnosed, next obviously comes the treatment and the prevention part. Many people, when they're diagnosed with cancer, they give up. They're like, oh, anyway, it's cancer, nothing will happen. No, nowadays treatments have improved a lot than what it was previously. Previously, it was thought, oh, it's cancer, we don't like have anything else to do. But wait for the person to die. But nowadays, it's not the thing. So treatment includes surgery, chemotherapy, radiation, targeted cancer treatments, small molecule inhibitors, antibodies, cell-based immunotherapy, gene therapy. So these kind of things are being used. So let's talk about chemotherapy. This is the most common cancer treatment that we get to see. So drugs used to kill cancer cells and disrupt some aspect of cell division. Toxic to healthy cells, the hair, the bone marrow, the lymphocyte, the epithelial cells of the intestinal lining. And side effects include hair loss. We all know cancer patients lose their hair, nausea, vomiting, and reduced immune responses. But those areas are also happening because of the treatment. Next, talking about radiation therapy. High energy rays are used to kill the cancer cells. It stopped them from growing and dividing. So radiotherapy is a local treatment. Local treatment in the sense where particularly the cancer cells are developed, we are targeting them. It can affect the cancer cells, but at the same time, some healthy cells can also get affected. Side effects can include tiredness, skin reactions like rash, redness, loss of appetite. Nausea is a very common symptom. Temporarily lowering in the WBC count, white blood cells. That can also happen. Certain surgeries are also there. It is localized to cancer surgery. Typically, it attempts to remove the entire mass. Next is biological therapy or immunotherapy. Here, what we are doing is we are trying to improve the immunity of the client. But this too is having a lot of side effects like temporary flu-like symptoms such as fever and chills, muscle aches, weakness, loss of appetite, diarrhea. These kind of things can also be there. Now, recently, a lot of different or new and improved drugs or medications are also there, which previously it was not there. And the drug companies on a recent basis have been taking regular updates from the cancer patients about the side effects and improving on the drugs on a regular basis. Now, we need to also educate the client about the prevention. So what are the things that we need to guide them with? Eating a healthy diet, exercising regularly, limiting alcohol intake, maintaining a healthy weight, minimizing exposure to radiation and toxic chemicals, not smoking or chewing tobacco. Even individuals who chew tobacco, on those packets also, it's written, chewing tobacco causes cancer. Reducing sun exposure, especially if you burn easily, that is also there. So hence, cancer is the second leading cause of death following heart disease. Yes, just a while ago, we were having a look in the bar graph, and we got to understand from the data. Same. And one should care about its prevention before the occurrence of the disease by various examinations. And if the disease is already existing in the person, then one should go for its regular treatment. Recent treatment mainly includes radiation therapy, cell-based immunotherapy, gene therapy, chemotherapy. These are most widely used methods used for treatments of various types of cancers. What type of treatment should be given to a client? That would be decided by the oncologist, depending upon the age, the type of cancer, the other body functioning or other complications, the severity. So one or more of the treatment procedures are being then decided. $32.6 million people are living with cancer within 5 years of diagnosis in 2012. Worldwide, this is data by WHO. Incidence rate of 205 to 165. per 1 lakh male and female, respectively. 48%, that means 15.6 million of 5-year prevalent cancer cases occur in less developed regions. Less developed because the diagnosis, the medical care, the intervention, those things, it's not happening in a proper way because of the limitation. That part is also there. Subspecialty of cancer dealing with 2 psychological dimensions. Psychological reactions of patients with cancer and their families and the healthcare providers, and psychological, social, and behavioral factors that contribute to the cancer risk, detection, and the survival. So slowly emerging as a subspecialty within oncology as well as psychiatry and psychosomatic medicine. It's the study of psychological aspects of cancer along the continuum from prevention to cure. So when we are talking about the cancer treatment team, so now not only the oncologists are there, we have an entire psycho-oncology team where oncologists or cancer doctors are there, social workers are there, psychologists who are trained to deal with cancer patients, they are there, psychiatrist is there, nurses are also there. Sometimes some specialized nurses are there. So they form a team and then they go ahead with it. Now, let us discuss about the stress coping and adaptation or maladaptation. So some patients have long-term negative psychological consequences. They worry about cancer, intrusive thinking, perception of less healthy organs, talking about the diagnosis, a crisis requiring quick adaptation to the catastrophic news is also there. There are 5 Ds with regard to this: death, dependency, disfigurement, disability, and abandonment, disruptions in relationships, role functioning, and financial status. All these areas are getting. So in the first phase, they are suffering from shock and disbelief. That no, this cannot happen. In the second phase, they are having anxiety, depression, insomnia, irritability for 1 to 2 weeks. In the third phase, they are gradually going ahead with adaptation and the treatment procedure. So when we are talking about these things, obviously this procedure is not at all easy. So for stages in the experience of treatment, the recognition and exploratory stage, that is the recognition of the symptoms and the diagnosis. The crisis or the climax stage, that is also there. When the treatment is initiated, the adaptation and the maladaptation stage, and survivors too face different psychological problems. So even if they are able to survive and overcome, then also they are having a lot of complications. Now, if we talk about the maladaptation part, take a look at this data. This is with regard to prostate cancer. We get to see higher rate of anxiety, depression, not significantly different from controls. This is with regard to research findings. Then in case of lung cancer, it mentions immediate reaction like tension, anxiety, change to other psychological distress after 6 months. So obviously these are very important areas that we need to consider. Anxiety, depression, these are the common things that we get to see in case of cancer patients. If these areas we are not able to deal in an appropriate way, definitely it is going to impact the person severely. People who are suffering from cancer and in an active stage, we get to see some psychiatric problems in them as well. So depression in palliative care settings mentions prevalence between 1 to 69%. Actual rate of depression is not clear. And most publications have used depression screens rather than diagnostic instruments. With regard to studies, we can see depression, adjustment, anxiety, this idea in case of cancer patients. So now that we are discussing so much about depression, and of course, this is one of the most common things that we get to see in case of cancer patients. Let us discuss about the diagnostic issues. So 4 conceptual approaches are there to evaluate the depression in medically ill patients. First, it's inclusive. All symptoms of depression are counted regardless of etiology. High sensitivity, appropriate for diagnosis in clinical setting. Next, it is exclusive. It eliminates the somatic symptoms from diagnostic criteria. High specificity and value for research. Talking about the etiological part, it includes symptoms as a part of depression. If not, it's clearly a result of medical illness. Difficult to apply due to symptom overlap. Substituted, that is, replace the somatic symptoms of depression with psychological symptoms, and little evidence for the superiority. Lots and lots of studies have been carried out with cancer patients. Another very prominent and a very saddening thing have been identified. Suicide. Yes. In case of cancer patients, we have been seeing that there is a high chance of suicidality. Because of the pain, because of the suffering, because of the limitation, they find it so difficult to cope up with everything. Sometimes the things become so difficult, they feel that there is no way out. But these people don't want to die. They want to live. But they feel the pain will only be over if I die. So patients at all stages of cancer may have suicidal thoughts. But in severe cases, we see it more. Carrying out this act is viewed for the future when they are not able to cope up with it anymore. Certain cases, they're abusing the drugs, or maybe they're stopping the medication. That is also passive suicidality. Knowing that if I stop this, slowly I will deteriorate and I will die. Patients in remission with a good prognosis, we see serious suicidal thoughts, which may represent the underlying psychiatric disorders. So suicide, depression, psychiatric problems are something which can be treated. So that part is also there. Patients with a poor prognosis and poorly controlled symptoms are there. So thoughts of suicide often appear rational. Patient may request advice about physician-assisted suicide. Patients require evaluation for the presence of treatable depression. Attention should be paid to quality of life issues and comfort. Suicidal wishes usually diminish with control of distressing symptoms. And patients in a terminal stage, there we see, they may request for euthanasia. That means, give me an injection with the help of which I will die. Or remove the life support. Such a request often reflects poor quality of life and hopelessness and depression at a severe level. So we need to maintain a supportive relationship with our patient. We need to help them control the symptoms to the extent possible. So the side effects of the treatment must be managed, like pain, nausea, depression. So in very severe cases of depression, only counseling may not help. So for those cases, a psychiatrist prescribes psychiatric medication, antidepressants, anti-anxiety drugs are often prescribed. With research, a strong correlation between physical health and suicidality have been found. So poorer the physical health, higher will be the suicidality. So make sure to check that the person is feeling better with regard to the physical. Or immediately we are able to look into those areas or not. We should involve the family and friends. That is also important. Because they need a lot of social support at that point of time in order to cope up. Allow the patient to discuss the suicidal thoughts. Often what family members do is, oh, stop it, don't say all this rubbish. Don't say the stupid things. These are not rubbish or stupid things to the patient. Actually, the patient is feeling those things. So allow them to vent out, allow them to share. It's not that if they're not sharing, it is getting deleted from their mind. So given intense ongoing support include open discussions about the treatment option. So here again, psychologist plays a very, very important role. Talking about depression and cancer further, the psychiatric issue is most studied in cancer is depression. Almost 99% patients with cancer will be suffering from depression. Even if they tell you that, no, I'm able to manage well, still an underlying depression is there. Hopelessness might be there. Depression acts as a predictor of non-compliance to treatment. So more they will be depressed, more they will be uncooperative. I don't want to eat. I don't want to go for chemo. I don't want to meet the doctor. I don't want to sit for counseling. So for uncooperative patients, the medication would be the last resort to treat depression. Depression acts as a predictor of mortality in cancer. It lowers the quality of life in case of cancer patients. So lowering of depression or the depressive symptoms, it will increase the survival rate of the cancer patients. That's what. Talking about other psychological factors impacting compliance. Social support. So we need to involve the family members so that more and more social support is there. Lesser the social support, they will start to feel, but nothing will happen if I die. Who bothers? Research by Gunfield et al. In 2002, it concluded that married women are more likely to adhere to chemotherapy than unmarried because they're more bothered that I have a partner. What will happen to my husband? What will happen to my children? 51.7% of clinicians reported that patients' social support was an important factor in their decision to give the palliative chemotherapy to women with metastatic breast cancer. Quality of life. So favorable quality of life enhances the adherence and the survival rate for cancer patients. That part is also there. Psychological factors as risk factors for cancer initiation and maintenance. There can be behavioral risk factors, stressful life events, locus of control and personality factors, coping and adjustment of illness, psychiatric diagnosis, repression of negative emotions. So all these things are also there. A major thing when we are talking about dealing with cancer patients, helping them to manage their stress level is mandatory, irrespective of how good treatment they are getting. If their stress level is high, then stress hormones would be released in the bloodstream and affect the functioning and the overall improvement of the patient. So mentioned by Godbout and Robert Gassler, 2006. Psychosocial factors as casual or maintenance factors for cancer initiation and progression. So one possible connection between stress and cancer development is the reactivation of the latent tumor promoting virus. Often it may get activated because of stress. Stress is associated in reduction in the activity of the natural killer cells. The fighting, the immunity deteriorates if the person is stressed. Stress-induced shift in the balance from Th1 towards Th2 cytokine profile may be permissive to the virus replication, and thereby it increases the frequency of tumor promotion. So now let me show you all with the help of a flow chart. This was given by Godbout and Ronald Glassler in 2006. Talking about the psychological stress. In case of humans, what we get to see? Academic stress, marital discord, primary caregiver, or any other family member or spouse, other factors. In case of rodents, resistant stress, social disruption stress, repeated food shock stress, other stress models. Any type of stress, it is affecting the immune dysfunction. The immunity is getting affected. Innate qualities, the NK activity to fight the cells, it's decreasing. Cell mediated, like wound repair, it is decreasing. Inflammation, it is increasing. Reaction to the latent virus, increasing. Adaptability, like antibody production to vaccination, it is decreasing. Infectious, increasing. So what is happening? Tumor promotion or progression. That means the cancer is growing or it is spreading. So that part is there. Further, when we are talking about the risk factors for cancer initiation or maintenance, with regard to that, personality plays a very important role. Cancer-prone personality. This is described as cooperative, unassertive, patient, suppressing the negative emotions, and accepting external authority too much. Type C constellation, it includes stoicism, perfectionism, over-agreeableness. These are the risk factors for initiation and the progression of cancer. A large study with 30,000 cancer patients in Japan was carried out by Nakaya et al. In 2003, which concluded no association between Eysenck's personality questionnaire revised scales and cancer risk. Personality factors and locus of control do not seem to play an important role. Now, talking about how to communicate a bad news, be it the diagnosis, be it the treatment failure, how to break the bad news, how to disclose that. Ravo and McPhee, 1999, used a mnemonic. Note this, ABCDE, based on the summary of review of 67 articles published after 1985. A, advanced preparation. So read the medical notes, practice the conversation, brace yourself for an emotional task, assess the patient understanding and arrange for a family meeting. B, build a therapeutic environment or relationship. Find a quiet place and ensure enough time. Use open body language and address the patient's fears. Next. C, communicate well. Be direct. Avoid any kind of medical terms or jargons. Use very simple, plain, non-technical layman term to make them understand. Use the words like cancer, death. Instead of talking about XY cell division has increased, XYZ drug failure and interaction, they don't understand this things. Ensure the patient is understanding. Very important. Allow silence for questions of patient or the family. Deal with the patient and the family members. So assess the patient's reactions and coping strategies. Listen actively and show empathy. Encourage and validate the emotions. That is, ensure accurate interpretation of the bad news. Address further needs, including support. Provide written information. Arrange follow-up. And process your feelings further. These are the things that we need to do. As we are discussing that we work collaboratively. So how does the collaborative care works? Take a look. Effective patient-provider communication should be there, where family or the patient is there. Patient-provider relationship patient-provider partnership is there, and the provider team is there. So together they are working on identification of the psychosocial needs of the patient, the psychological and the social needs of the patient. That will help in the development and the implementation of the future plan. What are the future plans? To identify the links the patient and the family with the needed psychosocial services, which will help for better support for the patients by providing personalized information, identifying strategies to address the needs, providing emotional support, helping the patient to manage their illness and health, coordinates the psychosocial and the biomedical care, and then together it will help in follow-up and rehab and evaluation. Further, it will help in further identification, and again, we will go ahead this way. This is how practically it is to be carried out. So collaborative way, we are doing it in this way, it works at the best possible. Apart from these things, there are some other psychotherapeutic approaches as well. Like crisis intervention. Many a time they are suffering from some kind of crisis. So we need to help them overcome on the crisis. Deal with the crisis. Immediate short-term intervention must begin. So support for the patient and their family. Help in making the patient understand the situation. Suggesting specific measures. Building the patient's hope by showing the perspectives for the nearest future. And of course, the psychological counseling is also there. So with that, we provide support offered to individuals experiencing the developmental crisis or adaptive difficulties. It involves several interviews aimed to identify a problem and find a solution. These are the things that we need to keep in mind. Apart from that, self-support groups are also there, where clinical psychologists are a part of it. Post-mastectomy, women, post-stroma surgery, emotional support. It helps one another in obtaining important information, which is very important for them. Equipment, medicines, and other things as well, which are associated. Psychological reattribution to address the direct, indirect consequences of cancer or treatment. Individual psychological therapy, like These are a part of the comprehensive care which is provided by oncology patients to women with diagnosed breast cancer. So as and when required, we are supposed to tailor the sessions to fit the needs of the patient. Next is relational psychotherapy. So preparing the patient for a physically or mentally burdening experience. Clear and understandable presentation of the treatment methods. Discussion of possible immediate and delayed side effects. And behavioral method of gradual desensitization. Gradually, we will have to decrease the sensitivity. To prevent anticipatory vomiting, pre-treatment, post-treatment, they vomit a lot as side effects. So we need to also, treat that anticipation that I will vomit. And out of that fear, they often skip treatment procedures. So that's a very important part that we need to address. To manage the distress regarding smell of medicines, aprons for children, helping them with some relaxation exercises so that their mind and body is much more relaxed. We also practice existential psychotherapy. Here, the capacity for self-awareness is developed. More freedom and responsibility. We can make the commitment to authentically choose a life for ourselves. That part is also there. The need for center and the need for others. The search for meaning. We have the capacity to discard old values, to freely choose new ones, and to continually question and challenge the meaning of life. Anxiety as a condition of living. It is the experience, anxiety as a source of growth and experience, the escape from anxiety. Awareness of death and non-being. That part is also there when we are talking about these areas. Also, we need to manage with cancer pain. Because of the health deterioration, because of the further treatment procedures, they experience a lot of physical pain. So cancer pain education is important. Here, hypnosis and imagery-based methods are also used. Today we have joined for a workshop, but in our certificate course in detail, we also, train you on how to go ahead with this using these activities. Acute procedural pain prior to breast biopsy, less evidence to chronic pain. These things are also there. We also help them with coping skills training so that they are able to better cope. Paying attention to spiritual needs and existential concerns, which are often associated with pain, that is also there. Next. Further, when we are talking about this part, psychosocial dimension of cancer in children. So we know children are also not safe. They also struggle. Cancer can also affect them. So talking about the family factors, flexibility of the family, attempts to bring normalcy to the adolescent or young adult's life. So presence of family cohesion and family adaptability is very important. Most adolescent cancer survivors are diagnosed with post-traumatic stress disorder. Also had mothers with PTSD. Training with these areas of guiding the family members or treating the family members is also important. Next is psychological or emotional factors. Higher intensity of symptoms are experienced by older children. So adolescents with cancer demonstrate more coping strategies than typical peers. We are talking about this area. There's increased risk of reporting psychological symptoms than siblings. Longer the adolescents were off treatment, more they perceived problems related to self-worth, social anxiety, greater negative perceptions and body image, which can further fuel their depression and anxiety, leading to increase in stress and affecting the immunity. Intense chemotherapy increased the risk of reporting somatic distress and depression. And most survivors reported that symptoms of depression, anxiety, or somatic distress did not pose problems in their daily life. So managing each of these areas becomes mandatory. Social factors are also there, like social treatment. So frequently they miss school. Cognitive deficits, they're not able to carry out the thinking, reasoning, problem solving, memorizing, attention, concentration in a better way. Appear more and contribute to difficulties with social skills. Survivors were less likely to graduate from high school. Survivors demonstrate greater impairments in friendships and romantic relationships than controls. Special issues in intervention. Here what we get to find is there is an emphasis on the age and developmental level of the child. School reintegration, like social skill training, adaptive coping skills at an early age, where parents as a major source of information. Maybe wise to refrain from disclosure of excessive medical information. That part is also there. Apart from all these things, there are also some other aspects that we need to be aware. Let us discuss about the same. We as mental health professionals or the oncology team, we also suffer from burnout. Burnout is a syndrome of emotional exhaustion, depersonalization, and a sense of low personal accomplishment that leads to decreased effectiveness at work. Depression, cynicism, sense of futility, and nihilism can be some of the common things that we get to see. Point of prevalence of 25% to 25% we get to see for medical oncologist. 38% for radiation oncologist. 28 to 36% for surgical oncologists. And no specific interventions like mindfulness-based meditations, techniques to increase the self-awareness might be useful. So we also need to treat ourselves before we treat our clients. That's the main thing. Take a look at this. This is with regard to distress and cancer satisfaction of medical oncologists relative to other internal medicine physicians. It's burnout, you can see. Satisfaction with specialty. Choice, so much high. The blue part is the burnout. Symptoms with depression, again, it's high. So we also need to take care of ourselves because the clients are pouring in so much. talking about the caregivers, we also need to deal with those parts. It affects the psychological impairment and mood disturbance. Anxiety by 39% and depression by 40%. Family caregivers' mental health burden exceeded that of the patient with cancer. So responses to cancer is interdependent. Each person is affected the other level of emotional well-being. Symptoms related to sleep disturbances. Then 90% have some disturbances. So it's not that cancer patients only treating the cancer patient. Treating the caregiver is also very important. Physical health care changes. High caregiving burden, an independent risk factor for coronary heart disease. 53% report fatigue. Neurohormonal and inflammatory changes can take place. And it's also perceived burden and positive aspects of the caregiver. What we get to see in them is lack of confidence, inadequate preparation to perform skills expected of them, disruption in lifestyle, and restrictions in activities. Changes in financial well-being is also. So that is again a serious burden for them. So we need to work for psychoeducating them, giving them appropriate information about management of symptoms, physical aspects of patient care, and attention to emotional aspects of care. We also go ahead with skills training, like development of caregivers, coping, communication, problem-solving skills. Therapeutic counseling is also there, like strengthening patient-caregiver relationships, managing conflicts, and dealing with the loss. Relationship-focused interventions are also there that addresses patient-caregiver communication and joint problem solving that have more positive outcome. Patient-caregiver that should be treated as the unit of care. And this is also something which is mandatory. So when we are talking about dealing with them, there are certain guidelines that we must follow. Kindly note this. Communicate with palliative care patients in an open, non-judgmental way. Patient-centered manner, and actively inquire about their concerns and their feelings. In accordance with patients' wishes, provide information on the nature, the course of the treatment, the illness, and the appropriate sources of support. Otherwise, they feel very lost. Consider referral to specialist palliative care for improved symptom control and psychosocial support. Prioritize cognitive or affective symptoms in detecting depression, as physical symptoms may be caused by physical disease or medicine treatment. Consider screening for depression in palliative care patients, because we have discussed so much. That's very, very important. Screening tools may help clinicians detect depression prior. The psychological state of patients in palliative care, unstable, regularly viewed depressive symptoms to capture the changes in mood. So to refer patients with depression to specialist palliative care for improved symptom control and psychosocial support. So consider antidepressants for treatment of depression in palliative care. And consider the psychological therapy for treatment of depression in palliative care. So when we are talking so much about palliative care, let us discuss also a little bit what this concept is with regard to the palliative care. So palliative care is basically an approach that improves the quality of life of the patients as well as the families who are facing problems associated to cancer. Through the prevention and relief of the suffering by means of early identification, impeccable assessment and the treatment of pain and other problems, physical, psychosocial, and spiritual. So when we are talking about these areas of palliative care, you can have a look. We'll be there from the very beginning through the hospice, death, bereavement care, throughout to give them enough support. It's more than home and less than hospital. Palliative care approach basically aims to promote the physical, psychosocial, and the spiritual well-being of an individual by managing on the psychosocial care, symptom control, and the disease management. Good quality palliative care can be defined as the care which one would be happy to have given to a member of any family member, if he or she was dying, or to receive the help till the last time. So when we are talking about this concept of palliative care is not a new concept. If we go to the history, it's not something new. Care of the dying has been a constant feature of human society throughout the history. We have ancient traditions in India of looking after those who are dying with special care and attention. These areas basically help them, support them with the best possible things. Now, when we are talking about these parts, it is very important to understand until and unless we are taking this seriously and struggling to go ahead with it and help the patient and family members, they might easily give up. So we cannot help them with the give up process. So it is very, very important that we deal with regard to these areas in an appropriate structure. So we need to go ahead with understanding the pain, the touch, the healing, the active listening, the mind shift, the presence of near and dear ones, avoiding unnecessary interventions, respecting one's will, not letting the sufferer feel underprivileged, treating and caring more through the heart than through the mind and brain is very, very important. Let's discuss about problems now. With a crude death rate of 6.24 per thousand and a population of more than 1 billion, the total number of people dying every year in India is about 7 million. More than 4 million of them would benefit from palliative care. But only less than 1% of those who need palliative care services have any access to such services in the country. Kerala is the only state in India to have medical and legislative norms to provide palliative care to the needy. So why not others? The present medical establishment with its hospital-centered services is geared basically to look after patients with acute illness. This acute care orientation is reflected in the current emphasis to illness diagnosis, patient-initiated consultations, and curative and/or symptom-relieving treatments. Patients with chronic and incurable illness, on the other hand, need regular system support, which is available for the community. So that part is also there. So here are certain points to keep in mind before we conclude. You should have a more empathetic attitude towards the sufferer. You must understand that caring doesn't end with the death of the patient, because after that, the family members are also there. Care should be by involving the family and other health associates. Pain is not just physical, it's more of the mind. A fundamental understanding of WHO pain ladder, a judicious use of the analogies. Palliative care is or can be given along with other ongoing therapies, and plan your death. Death autonomy or death will, depending upon the client's severity. Here are a few more key points to remember. Palliative care is not necessary for the terminally ill. It is not only for cancer patients, for other terminally ill patients also they do. Morphine is the best analgesic to be given for refractory pain management cases or severe unbearable pain. Oral medication can also be given. If it's not working, through IV injection also, it can be given. It does not cause addiction. Palliative medicine is a community approach, and it affirms the dignity at the end of life and ensures the bereavement care if we are not able to save the person. So ultimately, the goal is to do what is good for the patient, and as life is drawing to a close, to lead him towards a good or peaceful death. A good death is achieved when the patient's pain and other physical symptoms have been adequately controlled. So the patient has had bad time to evaluate his life journey, review his achievements and his failures, forgive and ask for forgiveness, reconcile with self, family, and God, and say, I love you, and accept the death and be ready to say goodbye. Not for all patients, for individuals where we are seeing that the person is moving towards death. So finally, talking about conclusion and the future directions. Psycho-oncology, though a new field, but is broad, and cancer patients can have negative psychological consequences at every stage of disease. Psychiatric morbidity have high and has grave consequences. Role of psychological factors in development of cancer. Not established, but behavioral issues have significant role. Psychological interventions are helpful in cancer-related physical symptoms. So further research is needed for better understanding of relationships between psychiatry and cancer. So with this, we are done with discussing about understanding the status of and the cancer problems, role and importance of psycho-oncology, the psychological aspects of cancer management, breaking the bad news, psychology of grieving, taking care of terminally ill patients, caregiver burden, palliative care, oncology burnout, and the euthanasia. So these were the areas I wanted to cover for today's session. Okay. Yes. So now that we are done with the discussion, if anything from your end also, if any of you would like to contribute, you can go ahead. And by the time you are sharing, let me also guide you about the certification process. So all of you who have attended today's session, you are eligible for the certificate. We will share a Google link with you all where you will have to enter your details. And also the necessary things that need to be presented in that Google sheet to recheck it so that there is no spelling mistakes or anything you are not mistaken. After that, we will proceed with the certification. The certificates take around 15 to 17 working days for you all to receive it. We will update about the same in the WhatsApp group itself. Also, to share your valuable feedback of what all you learned from today's session and how you benefited from the session. Yes, I can see your hand. Please go ahead with your question. You need to unmute.
Yeah, hi, ma'am. This was really informative. And I would like to ask you about, as I told you, my mom. The thing is, she has a lot of anxiety, there's no depression, and she's a perfectionist kind of. So how do I help her to overcome this? Because I want her to be happy, apart from for the physical pain and all, we can't help it, but for at least psychological, I want to
See,
so.
in this case, generalized way we cannot guide the patients. So for that, a detailed case history, what she is going through, what all thoughts she is having, what all things are triggering that anxiety, what is underlying, those things can be of help. Many a time what happens is family members don't open up in front of us, feeling that if I say these things, then my daughter, my son will be panicking way more. But if you can refer to a mental health professional, maybe she would find it easier to open up.
She's not ready to go.
Apart from like that would be a limitation. But in a generalized way, if I'm suggesting, then breathing exercises, breathing techniques, mindfulness, relaxation techniques, these things would be of help. CBT is also of help, but again, with family members, it won't work. That's the point.
Okay, ma'am. Thank you so much.
Like, yes, I can see another hand. Please go on.
Yeah, I want to ask that there is some kind of resistance also that even the patients and the family members feel regarding psychotherapy. So what's something that a therapist can do that time in these situations?
Yes. So till now, people are having a very wrong concept about counseling. They feel, okay, I'm mentally weak, that's why I need counseling. So nowadays, what happens is, in the entire treatment package, it is included. Instead of mentioning counseling, you can also mention stress management. You can also mention this is a place where you can vent out your emotions. They feel that, oh, another person will be suggesting me what I need to do. And at this age, I would listen from someone younger than me that do this, do that. So this kind of things come up. So better to say stress management, which will help in the immunity boosting. And they are a oncology team. You can mention that this is coming under the oncology treatment. Just like you're going for chemo, just like you're going for surgery, just like you're taking medicines, just like you're going for immunotherapy, this is for stress management. Once they join the session, they become little comfortable, then they will open up like anything. But the start is difficult. That's what. I hope this would help. Yeah.
Thank you.
Right. Okay. So I would like to thank each one of you for showing an interest and for being there for so long. It was really a very lengthy topic and lots of things we have covered. Also, we are having a detailed certificate course on Psycho-Oncology. So you can stay updated by keeping a check on our website. Or also you all have my number. I'm also sharing it on screen. And from my number only, I did share the welcome message and the link for joining today's session. You can save it for future purposes. So be it for any other course, internship or workshop update, be it for any other suggestion, be it for client referral, you can definitely stay connected with me. I may not be able to take up calls, but just drop in a message at my personal WhatsApp window and definitely help you out. Yes, you will be getting resource materials. I'll be sharing those things by the end of the day. You will be receiving it. Download and save it, because in WhatsApp, it shows later on that you can't download it. As soon as I share it, download and save it.
Ma'am,
Yes.
ma'am, my mother is an Alzheimer's patient. So
Mhm.
today's session was very good and very informative. So I would request you in future, if Psycho-Shiksha or you can arrange another workshop or one-day training on the counseling of not only the Alzheimer patient but also the family members of them. Because regarding me, sometimes I feel impatient since my mother forgets everything, every little bits and bits sometimes. So I become impatient. So I think sometimes I also need some kind of guidance that what should I do and what should not while dealing with Alzheimer's patient. So can we hope that in future.
We consider this and we will definitely plan for the same in future. Thank you for noting this.
Thank you.
Yes. Welcome. Yeah. So as it's time limited, we will keep it till here today. And there are many more things that we are yet to learn, which is covered basically in the detailed oncology course. Also, oncology patients, another thing I would like to mention, this is with regard to while I have been dealing with my clients, as one of you just requested about some case study. So just mentioning on this a little bit. They suffer from a lot of death anxiety. Even if the doctor is mentioning that your case is not that serious, then also they suffer a lot from death anxiety. So managing on that part also becomes important. So medicine cannot manage that death anxiety. Psychology can help. So first of all, training the person with regard to the other areas is important, and then gradually become this. So death anxiety is also a very common thing that must be. Okay. So for individuals who don't know, every Sunday we hold workshops. The next Sunday we are again having a workshop. Next Sunday's topic is home-based behavior management techniques. So that is again a very important part. Any of you who is interested, you can check with the website and directly join in from there, or you can connect with me at any point of time. Just drop me a message. I'll also help you out. Okay. Thank you so much, everyone. Do share your valuable feedback, whatever you have learned in our WhatsApp group. And I wish to meet you all soon in some other course, internship. Take care, everybody. Have a great day. Thank you so much.